Well, it's great to be chatting with you, Melina. I'm looking forward to learning about what it's like being a physiotherapist. And my first question for you is, what inspired you to choose physiotherapy?
At first, I wanted to be an occupational therapist, but I switched it to physical therapy. I always enjoyed helping people, or at least that's what I guess that's what everyone says. And I thought it would be interesting. I always liked biology. Thankfully, I didn't need physiotherapy any time in my life. I had a lot of friends that did, and I saw their experiences. I also shadowed a physiotherapist before I went to study, and it seemed like something I could do. I was doing ballet classes for a lot of years, and I think that helped me think about how you could sort of strengthen in the correct way so there's not so many injuries in that area.
Right, because dancing, ballet, and I imagine other kinds of dance can be quite strenuous on the body. And
Yeah.
so it makes you aware of how to strengthen your body and then what could go wrong.
Yeah.
What's the difference between physiotherapy and occupational therapy? I always thought they were the same thing.
Occupational therapy is more you work with kids that a lot of kids that have like special needs, like either with autism or cerebral palsy, and you try to get them to it's more like helping them with everyday tasks,
I
instead
see.
of the whole physical picture.
I'm curious to know what a typical day at work looks like for you.
I work in outpatient care, so it's a private physiotherapy center. So we get a lot of musculoskeletal patients, a lot of orthopedic issues. We do get some neurological patients,
Hmm.
um, but very few in comparison. Everyone makes appointments beforehand, so I know my patients before I get into work.
You've read through their file?
Yes, I know their history. I know what their examination was. I know what the the diagnosis is, so I can prepare beforehand if I want to. And I usually see 8 patients a day, and an hour each session or 50 minutes each session. A lot of patients are older, so it's 60 and above, usually with orthopedic issues, back pain, or trauma after an injury.
You mentioned earlier when we were talking before we started recording that sometimes the issues you have to tackle with the patient are psychological.
Usually, older patients, they come and they need to, some are alone, they just want someone to talk to. You just have to listen to them, and I didn't expect there to be so much of that. Or like for them to come with their problems and you not knowing what to say, or telling you about their neighbor that passed away or something. And
Hmm. And I'm sure it helps that when they're with you, they feel relaxed.
yeah, they feel relaxed. They feel like they can talk to you or tell you their problems, and we try to encourage them. So
What do you find most challenging about being a physiotherapist?
I think probably dealing with that the amount of people we deal with every day, actually.
Right. 8 patients a day is maybe too many patients. Sometimes perhaps it's easier because the patients have simple issues to deal with, but other times it
Yeah.
must be quite exhausting.
In my case, it's not always like one individual patient each session. It's sometimes we do group therapies, so it's group therapies in the water, or
Ah,
like group clinical Pilates. I realized that patient education is actually a lot more important than what university tells you. They always
okay.
mention it that you have to educate the patient, but it does wonders, honestly.
Right. So it's not just a matter of performing some kind of, I don't know, a
It's not always
stretching
yeah,
activity with them. You also have to teach them how to do that at home.
yeah, you have to
Um,
teach them how to do it, and you have to educate them on what to do at home, like the way they're sitting, the way they sit in their car, the way they stand up, or the way that they keep sitting at work and the computer is not their ergonomics, basically.
Mm,
or not to sit too low if they have a certain problem with their knees, like if the toilet's too low or something, to put pillows in the bed. Um,
right. It's like asking them to change a habit, though. So it must be quite difficult for them to, say, remember to sit up when they're slouching or
yeah,
perform a certain stretching activity at a certain time every day. You really have to
yeah, we try not.
encourage them.
Yeah, we
Mhm.
try not to make it too hard. Like if we give them exercises at home, let's say let's start with 3 exercises, and most of the patients, yes, we know won't do them. But if they're in enough pain, they will, and hopefully it will help them. And we try to get them into in our specific setting, at least. Once we see a patient with chronic pain, we try to get them, especially low back pain because it's the most common. We try to get them into like a group program so they can have exercise long term.
Do you find time to stay up to date with the latest trends or developments in the practice of physiotherapy?
I try to. It's hard when you're working that many hours, but it's something I think you have to do. And after you've been working a bit in the work setting, and if you figure out which area you like the most, it's good to um, try to expand your knowledge in that area. Go to seminars all the time. I know a lot of physios that keep going. They might be in their 30s, 40s, and they still go to seminars or conferences just to keep up to date.
I think any um, professional who's serious about their work will try to keep up with the latest trends or at least develop their own practice and try to improve. Is there a particular method, technique that you picked up in a seminar that made a big difference to your practice?
I can't think of anything right now. Once I did the clinical Pilates seminar, it helped me a lot in expanding my knowledge on exercise, on different exercise. Basically, it expanded my library of exercise. How would I put that?
Oh, okay, because you have a bank of exercises.
Basically, yeah. That I think of whenever when I have a certain patient with a certain problem, I have a few exercises in mind, and basically the clinical Pilates course gave me a bit more understanding, a bit more exercises that I can use for each patient, give me more understanding of how to treat low back pain in particular, and what exercise to give.
What are some useful tips that you could give the average person if they wanted to avoid having too many problems?
I would say exercise.
Exercise? Okay.
Exercise, yeah, exercise at least. Like try to make it a routine to exercise or be in some sort of group, even if it's like in the water, pool aerobics, or something that you like. Because we try, as physiotherapists, there's a misconception that we try to get people out of sports and what they like doing because it hurts them or whatever. But we don't want to do that. That's not our goal. We want you to keep doing what you like, but to get stronger in order for you to do that what you like pain free, basically.
Right. You've mentioned lower back pain quite a few times. Is that the most common problem that you
I think
see?
so, yeah. Basically, lower back pain, anything with the spine, lower back pain, neck pain. A lot of, I would say like 60% of the people that have low back pain have seated like office jobs, maybe even
Okay.
more, maybe more.
And do you notice that there are more men or women who come to see you?
Um, I think it's a mix actually, but actually maybe more women, but I'm not sure. It might be because in the groups mostly women join, so that could be the reason.